Hello everyone, we're developing a smart heart patch for congenital heart defects.
Congenital heart defects, or CHDs, are structural problems in the heart or major blood vessels. They're the most common type of birth defects, and in the US alone, there's one in roughly 110 cases per year, according to peer-reviewed sources. There are many different types of CHDs. The most common type are ventricular septum defects, or VSDs, and our project focuses on these. VSD is a hole in the heart's lower chambers that is a septum wall, allowing oxygen-rich blood to leak into the right ventricle. This is not good because it makes the heart work harder, as well as leads to lung congestion and potential failure over time.
So VSDs are the most common type of congenital heart defect in children, accounting for 30 to 40% of cases. Approximately 40% of these will close spontaneously, but for those that don't, surgery is almost always required. Surgery can lead to a number of postoperative issues, including residual VSDs, which are small holes in the heart that remain after surgery, which can lead to left to right shunting, complete atrioventricular blocks, which block the electrical signal from the atria from reaching the ventricles, and that can lead to inefficient heartbeat. And then aortic regurgitation, which means that some of the blood will go back into the left ventricle from the aorta during heartbeat, and that can lead to an increased risk of bacterial infection. Overall, all of these will significantly impact a child's quality of life.
Now, for our design of a smart hydrogel, first we selected a tunable and biocompatible material. GelMod is a polymer that can be polymerized by UV curing, and that allows us to 3D print GelMod into a desired shape or size. GelMod is also biocompatible because it is derived from gelatin, which is also derived from the natural protein collagen. Because GelMod has a tunable degradability depending on the cross-linking density of the UV curing duration, it allows us to control how fast or how slow this hydrogel will degrade, which is especially important for our pediatric focused patch.
As the hydrogel degrades, it will release a lot of drug-eluting particles, including VEGF, VEGF, and IGF-1, which are all growth factors that improve cardiomyocyte regeneration and neovascularization. It will also release ANGPTL4 and heparin, which are anti-inflammatory and anticoagulant agents to help mitigate fibrotic scar.
Third, we embed electroconductive particles to help restore the electrical function of the heart tissue. The heart relies on these electrical signals to keep a rhythm and maintain proper blood flow, but this can get disrupted depending if the tissue is damaged or underdeveloped. We chose RGO, or reduced graphene oxide, because of its tunable conductivity up to 10⁻³ Siemens per centimeter, which is especially important in this sensitive heart tissue for pediatric patients. Lastly, we'll conduct extensive mechanical and release rate drug testing in vitro models, and hopefully use these results to move on to in vivo models.
Here are some of the existing alternatives. Firstly, we have a Dacron patch. Sometimes the heart tissue will grow over the patch and it doesn't need to be removed later with a second surgery. In most of those cases, though, it will grow into scar tissue, which can cause chronic pain, among other issues for the patient. In many cases, the patch will need to be surgically removed, and for a lot of pediatric patients, it will need to be replaced with a larger patch, which then needs to be removed later as well. In some pediatric patients, they may need to have 3 or 4 or 5 or even more patches throughout their lifetime. Gore-Tex, which is a Dacron alternative, works much the same way, but with 1 patch instead of the 2 that you can see in the diagram. And lastly, we have a pericardial graft, which is using existing heart tissue to solve the problem instead of foreign materials. Our patch would only require a single surgery. Each of these open heart surgeries can be upwards of $27,000 USD. Because our patch is naturally biodegradable, it wouldn't need to be removed, and because of all of the growth factors, scar tissue wouldn't form. This drastically lowers both the risk and cost for the patient. Additionally, because GelMod can be 3D printed, our cost of materials and cost of manufacturing is extremely low. The major cost is the growth factors. BFGF is the cheapest of them and is about $180 for just 10 micrograms. Even with this relatively high cost though, our patches would be extremely cheap when compared to current alternatives. Thank you.